Welcome to Module 9. In this module, we will be discussing cancer in children. Last year, approximately 11,000 new cases of cancer were identified in children from birth to 14 years old. And about 1,200 children will not survive this diagnosis. Compared to adults, childhood cancers do remain very rare. Although many improvements in cancer treatments have been made, and cancer death rates for children have steadily declined, cancer remains the leading cause of death from disease among children. The most common types of cancer diagnosed in children are leukemia, which is a cancer that begins in the blood-forming tissue, such as the bone marrow, brain tumors, lymphomas, which begins in the cells of the immune system, neuroblastoma, which begins in the nerve cells, retinoblastoma, which begins in the eye, the retina, and Wilms tumor, which is a tumor on the kidney. Pediatric cancer is very different than adult cancers. First, the causes of most childhood cancers are not known. Pediatric cancer differs from adult cancers in the way that they grow and spread, how they're treated, and how they respond to treatment. 80% of adult cancers are preventable and have a strong environmental influence, like smoking. In pediatric cancer, only a very small amount of environmental influence is proven, and little is known about cancer prevention in kids. Children, however, are very responsive to cancer treatments. There are many different types of cancer treatments. The types of treatment that a child with cancer receives will depend on the type of cancer and how advanced it is, but common treatments do include surgery, chemotherapy, radiation therapy, immunotherapy, and stem cell transplant. Now, pediatric cancer survivors must also be aware of long-term sequelae. Late effects of cancer include other cancers, learning problems, emotional problems, reproductive problems, and more. When you're completing the readings for this module, be sure to understand what the common signs and symptoms associated with pediatric malignancies are, how to care for the child and the family with neoplastic disease, understand what the late effects and sequelae may be in survivors of childhood cancers. And lastly, how to recognize and care for children with those different cancers that we discussed: leukemia, Wilms tumor, retinoblastoma, lymphoma, brain tumors, and neuroblastoma. Thanks.